In a normal, typical setting, traditional assessment for infants, children, and even adults with disabilities typically consists of standardized tests, and these tests have been used for thousands and thousands of people. And so we get these average scores that then we compare the person to that we're on whom we're doing the assessment. So a lot of times this includes an IQ test, an achievement test, some other kinds of tests that have these standard scores. When you think about standard scores and standardized assessment, they're based on the test scores of people without disabilities. So we're looking at an IQ test that has been given to 10,000 people, and average scores have been calculated. Scores for cognitive impairment have been calculated. Scores for those who may have a gifted or genius level intelligence have been calculated. But none of the people on whom the test was standardized had any kind of disability, typically, especially not deafness, blindness, balance disorders, any of the things that our children with CHARGE syndrome have. And so they're really not appropriate to use. We can use them to try to find out some strengths and needs of the people, but it's not appropriate to use the scores because the scores are not valid for this population. So we need to come up with some other way to do assessment of the needs and strengths of people with CHARGE syndrome. Assessments can be used at any time of transition and in terms of trying to define eligibility for a person for services. In the US, we're often looking at eligibility. Does this person qualify for the funding for special education? Does this person have a need for nursing services or to have a person in their home living with them? We're often looking at what are the person's needs and how can we help them? And the assessment helps us determine that. So this can happen at infancy. This can happen at school age to find out what kinds of educational needs the person has. This can happen at transition time into adulthood to find out what kinds of work the person enjoys, what kinds of skills they have for living alone, and how to plan programs. So basically, assessment is supposed to have a question behind it, and you plan the assessment based on the question you want answered. So if the question you want answered is, what should my child or what should my student be doing once they graduate from school, then you would design the assessment to figure that out. And then the assessment is supposed to give you results from which you can then plan. A score in and of itself doesn't give you those kinds of results. A score can give you eligibility or can tell you a little bit about the person's cognitive ability or their ability in math or reading, but it doesn't really give you rich information in terms of what to do next to help this person. In a traditional assessment, you typically see, as I was saying before, standardized tests. The team members tend to split up which tests will be given. So each team member, depending on their area of expertise, will use a different assessment instrument. So you may have the physio assessing the physiological functioning of the person, the psychologist assessing the cognitive function. You may have an occupational therapist assessing fine motor skills. A speech and language therapist may be assessing communication. You may have someone else assessing social needs. So everyone kind of does their own separate thing. And in the US, what typically happens is everyone comes together in a meeting at the end of the assessment and discusses all of their results together with the family to then go and make a plan. So the plan then comes to coming up with goals and objectives for the person to then try and move toward for the next period of time. In my experience, a traditional assessment doesn't always involve a lot of parent input, but sometimes that is because of time constraints. So for instance, my first year as a school psychologist, because we have a law here in the US that says every child must be evaluated every 3 years, and psychology services are expensive, I was given 100 assessments to do in a school year. And when I started my job, I was 30 cases behind, and it was impossible to ever catch up. And so it was often send a letter to the parents. We didn't have email then yet. Send a letter to the parents asking for their input, or phone them and ask for their input over the phone, do the assessment, write the report, go to the meeting and read the results. if things were perfect, we would be able to spend about a week with each child and their family and their teachers and their therapists and do really clear planning and be able to come up with much better results and much better ideas for moving forward. But assessment has become this sort of check off the boxes sort of system where people just want to get the work done and move on to the next case. And so parents sometimes get left out of that, and that's not good practice. We need to do some different things for children with CHARGE syndrome, and that is because they have multisensory impairments. So for example, you really cannot use standardized assessments with them. We need to come up with new ways to do assessments of their needs because they have communication difficulty often. Many of them have a lot of medical difficulties. The balance disorder can be a real problem. They need to be able to stabilize their head in order to see and for their eyes to work correctly. And so not only do we need to have assessment plans, ideas, and instruments that will work for these children, we also need to understand CHARGE syndrome and understand the individual child's needs before going into any kind of assessment. So part of the assessment itself is understanding the child and who they are and where they're coming from the beginning. So just observation is a huge, huge part of this. Observation, speculation, coming up with ideas, consulting with the professionals who know the child, spend a lot of time with the family, understand the behavior of the child before you can really carry out any kind of real formal assessment. So it's very important to not only just include the family in the assessment, but have the family help drive the assessment. Parents know their children best and have a wealth of information about their child's background, health-wise and educationally. And if they're left out of the assessment, you're missing a large piece. And so having the family be a huge part of it and take part in the answering the questions on what they want for their child and what they think their child needs is so important. And it gets them on board, and the whole team can then work together and respect the fact that this family has a life outside of school or outside of the programming that the assessor is involved in, and see the whole picture, see the whole child.